So for today, we will be discussing factors affecting human behavior. So we all know na magkakaiba talaga ang behavior ng bawat tao. Depende yan sa kanyang environment, depende yan sa pagpapalaki sa kanya, kung papaano siya magdesisyon sa mga bagay-bagay. Yan. These are different factors. But in this lesson, we will be discussing everything na maaaring makaapekto sa human behavior. So this lesson, tayo. So this lesson presents the selected factors affecting human behavior such as emotion, conflict, depression, stress, and frustration. So yung mga yan, yung mga nabanggit na yan, are several or some of the factors that can affect how we react to a certain situation that we are faced upon. So emotion, conflict, depression, stress, and frustration. So the learning objectives are, so at the end of the lesson, you should be able to analyze how emotion, conflict, depression, stress, and frustration contribute to criminality. So, discuss muna natin kung ano ba ang ibig sabihin ng emotion. Pero ayaw niya. Ayun. So, emotion refers to feelings, affective responses as a result of physiological arousal, thoughts and beliefs, subjective evaluation, and bodily expression. Kaya, sabi dyan, may bodily expression and meron ding physiological arousal. So, well, physiological nga siya, edi physical, pertaining sa katawan mo. Okay. It is a state characterized by facial expressions, gestures, postures, and subjective feelings. Magdedepende din yung mga facial expression natin base sa ating emotion. Kung galit ka, usually nakakunot ang noo. Kung galit ka at tumatawa ka, yun, medyo hindi akma ang facial expression mo doon. So, kailangan mong tignan, baka may problem yung tao na ganun. Okay. So, it is associated with mood, temperament, personality, and disposition. Okay. So, the English word emotion is derived from the French word émouvoir. So, this is based on the Latin émouvoir, where e means out and movere means move. So, the related term motivation is also derived from movere. Okay. So there are several theories of emotion, one of which is the James Lang theory by William James and Carl Lang. Obvious naman. Siguro galing yun sa pangalan nila, hindi ko sure. This theory states that emotion results from physiological states triggered by stimuli in the environment. Emotion occurs after physiological reaction. So, kung ano yung nangyari sa katawan natin, yun yung posibleng cause ng ating emotion. For example, masama ang pakiramdam mo, masakit ulo mo. So, yung emotion mo doon ay magde-derive doon sa sakit ng ulo mo. So, baka bad trip ka, yung mga ganon. Kasi nga, hindi maganda yung nararamdaman mo. This theory and its derivatives states that a changed situation leads to a changed bodily state. As James says, the perception of bodily changes as they occur is the emotion. So, kung paano natin i-perceive o tanggapin yung pagbabago sa katawan o kung paano natin tanggapin yung naramdaman natin physically, yun yung magiging emotion din natin. Another theory of emotion is the Cannon-Bard theory. So it is by Philip Bard and Walter Cannon. This suggests that people feel emotions first and then act upon them. Baligtad naman kumpara dito sa gawa nila James lang. Kasi kay James lang, reaction daw ang emotion mula sa physiological basis. Okay. And then ito naman kay Canon Bard, emotion daw muna, tsaka tayo, so we feel emotion first and then act upon them. Kumbaga, yung reaction na, nagkakaroon tayo ng certain reaction doon sa naramdaman natin. This is a theory that emotion and physiological reactions occur simultaneously. Sabay daw sila. Hindi tulad kanina kay James lang, theory, una, ang physiological. And then, tsaka ka magkakaroon ng certain emotion. But in Canon Bard, sabay daw. These actions include changes in muscular tension, perspiration. Yun. The theory was formulated following the introduction of the James Lang theory of emotion in the late 1800s, which alternately suggested that emotion is the result of one's perception of their reaction or bodily change. Then another theory of emotion is the two-factor theory. This theory was provided by Schnachter and Singer, in which they posited that emotion is the cognitive interpretation of a physiological response. For many, this remains the best formulation of emotion. So most people consider this to be the common sense theory to explain physiological changes. Their physiology changes as a result of their emotion. Okay, next is emotional intelligence or EI. Hindi lang, pag sinabi nating intelligence, hindi lang ito sa talino, na madami kang alam. But ang isang parte nun is emotional intelligence. Remember that there is this theory na ang tao merong multiple intelligence. Merong musical intelligence o kaya sa sports. May nadagdag pa nga eh, yung sa cooking na ibang uri ng intelligence daw kapag mahusay kang magluto. Ganun. So, isa doon, sa multiple intelligence na yun, is your emotional intelligence. It is the area of cognitive ability that facilitates interpersonal behavior. Interpersonal, so sa sarili mo lang. The term was popularized in 1995 by psychologist and behavioral science journalist Dr. Daniel Goleman in his book, Emotional Intelligence. Dr. Goleman described it as a person's ability to manage his feelings so that those feelings are expressed appropriately and effectively. Kasi bilang tao, magkakaiba tayo ng pagtanggap sa isang situation. Sabi nga kanina, 'di ba? Magkakaiba tayo ng paraan ng pag-perceive sa isang circumstance. At kung papaano tayo mag-react doon, kung ano man yung feelings natin tungkol dun sa situation na yun, uh, if we have a high emotional intelligence, then we will be able to express our feelings appropriately and effectively. Kasi hindi sa lahat ng pagkakataon, pwede mong uh, gawin lang o sabihin lang yung nararamdaman mo. Kasi we have to be sensitive also to other people's feelings. Ayun. So it is the capacity to understand and manage emotion. Naiintindihan mo kung ano yung nararamdaman mo. So kaya mo siyang i-manage. Alam mo kung kailan mo ilalabas yung nararamdaman mo or kung kailan appropriate na itago mo muna o kimkimin mo muna yung nararamdaman mo. May certain circumstances na akma yung mga yun. So however, the content and boundaries of this construct remain unsettled because mahirap talagang ah, bigyan ng standard ang emotion. Na kapag nagkaroon ng ganitong situation, ganito lang. O meron lang isang paraan. May isang tamang paraan lang ng pag-react. Walang ganon. Kaya, of course, it will remain really unsettled. Mayer and Salovey who originally used the term, defined it as the ability to perceive emotion, ah, ano 'to, empathize ka sa ibang tao, integrate emotion to facilitate thought, kung papaano mo dapat ipakita yung emosyon mo para maintindihan ng iba kung ano yung ibig mong sabihin. Understand emotions and to regulate emotions to promote personal growth. So that is emotional intelligence. Alam mo rin kung papaano makiramdam sa ibang tao. Hindi yung salita ka lang ng salita, hindi mo alam nakakasakit ka na pala. Salita ka ng salita, hindi mo alam may mga na-o-offend na pala, kaya hindi nagugustuhan yung mga sinasabi mo. Gano'n. So there are 5 components of emotional intelligence, and this is by Goleman. First is self-awareness. Alam mo, kilala mo yung sarili mo. Alam mong kontrolin yung mga ah, etong number 2, alam mong kontrolin yung nararamdaman mo. That's self-regulation. Nare-regulate mo yung sarili mo. Alam mo kung kailan magre-react. Alam mo kung kailan ipapakita yung feelings mo. Alam mo kung kailan hindi. And then number 3 is motivation. Number 4 is empathy. This is putting yourself in one's shoes. Yung kung ikaw yung nasa lugar niya, ano kaya ang magiging damdamin mo? That's kapag kaya mo yon, that's you have good empathy skills. And then social skills. Yan. Ang skills hindi lang yung marunong kang gumawa ng mga bagay-bagay, marunong ka mag-drive, marunong ka mag-weld. Hindi yun, hindi lang yun ang mga skills na dapat meron ka. Kailangan may social skills ka din and may empathy skills ka din. Kasi kailangan mo yon kung gusto mong ah, makisama. Nagtatrabaho ka na, yung mga gano'n. Kailangan kasi, anong tawag dito, hindi kasi sa'yo lang umiikot ang mundo. You have to be understanding na gano'n nga, hindi lang sa'yo umiikot ang mundo ng isang tao. Kaya, ah, you have to understand their feelings, their reactions to certain situations. Okay, next is emotional intelligence and criminal behavior. First, these are researches na kinonduct. So the group of convicted offenders obtained significantly lower scores on all the domains of MEII, the Mengal Emotional Intelligence Inventory, such as intrapersonal awareness, own emotions, interpersonal awareness, others' emotion, intrapersonal management, own emotions, and interpersonal management, others' emotion. Mabababa daw yung mga, yung 4 na yan, sorry, 5 pa, and aggregate emotional quotient in comparison to their normal counterparts. Yung mga convicted offenders, mababa daw yung mga ganyan nila. Researchers concluded that convicted offenders group had significantly lower emotional intelligence compared to normal subjects. Starting emotional intelligence enhancement program in prison can help the inmates better understand their feelings and emotions. Minsan kasi, alam niyo yung mga bata, nag-act out kasi hindi niya alam kung paano i-express yung sarili niya. Hindi niya alam paano sabihin kung ano yung nararamdaman niya. So, kung meron daw nito sa prison, ano yan? Emotional intelligence enhancement program, then prisoners or persons deprived of liberty would be able to express themselves better and would be able to understand others better. Para paglabas nila mula sa kulungan, makakasabay sila sa society. Kumbaga, well reintegrated sila. Emotional intelligence is deeply related to aggression and offending. Kaya nakagagawa ng krimen kasi baka may pagkakataong bumaba yung emotional intelligence or hindi na kontrol ang kanyang emosyon. Kaya, na nga, naging aggressive at nakagawa ng krimen. Persons with high emotional intelligence levels are more able to moderate their emotions and are less impulsive because they are able to think before they act or before they act on their emotions. On the other hand, individuals with low emotional intelligence levels are more prone to risky behavior. Ito yung mga taong kailangan ng anger management. Okay. They also have a hard time understanding situations from the perspective of others and therefore tend to be less empathetic. Hindi nila maintindihan yung pinanggagalingan ng iba. Hindi nila magets kung bakit ganito ang certain reaction ng isang tao. And then, another one is a reduced capacity to regulate emotions could possibly maintain offending pattern of behavior in criminals. Kasi nga, they act on impulse. Kapag naisip nila, gagawin na nila. Kapag, ah, sabihin na, kapag nalibugan sila, diretso na yun, maghahanap na yun ng i-rape niya. Kasi nga wala siyang control. But, if a person has a high EI, tama ba yung sinabi ko? High EI. Dalawang isip pa ako, may H ba yun? High EI. Yun na nga, they would be able to regulate their emotions. So, hindi, makokontrol nila yung sarili nila at they would not act on impulse. So, for example, internet child sexual abuse is often preceded by unregulated negative feelings. Number five is a reduced capacity to regulate anger, desire, and sexual arousal may result in an assault, theft, and sexual assault, respectively. Some recent studies consistently report EI deficits in criminals. In addition, some studies indicate that offenders are deficient in subcomponents of EI, such as social problem solving, empathy, social competency, flexibility, impulse control, and self-regard. Pero kung mataas naman ang EI mo, then you will be able to possess all this. Magiging flexible ka. Magiging empathetic ka. You can live well in society. You'll have friends. You'll have relationships. Yung mga ganun. Okay? Okay, so that is for emotion. The next topic is conflict. It is a stressful condition that occurs when a person must choose between incompatible or contradictory alternatives. So this involves decision making. Kapag meron kang alternatives na hindi sila akma sa isa't isa, yung hindi mo sila pwedeng pagsabayin, that's conflict. So it is a negative emotional state caused by an inability to choose between two or more incompatible goals or impulse. It is the state in which two or more motives cannot be satisfied because they interfere with one another. Yung meron kang problema at meron kang alternative kung papaano masolusyonan yung problema. Pero hindi mo sila pwedeng pagsabayin, yung dalawang option mo na yon kasi incompatible sila. Ganon. Okay? So there are three types of conflict. We have psychological conflict, social conflict, and approach avoidance conflict. So there are four kinds of approach avoidance conflict, and this will be your assignment. So meron tayong approach conflict, avoidance conflict, approach avoidance conflict, and multiple approach avoidance conflict. So sa assignment ninyo, you will give me examples kung paano ma-describe ito or mai-illustrate itong mga approach avoidance conflicts na to. Yeah, mamaya na yan. Okay, dito muna tayo sa functional versus dysfunctional conflict. Hindi kasi sa lahat ng Hindi kasi sa lahat ng pagkakataon masama ang conflict kasi minsan may conflict na nagdudulot ng maganda. For example, debate, 'di ba? Magandang nagkakaroon ng debate kasi napag-uusapan yung mga topics na kailangan mapag-usapan and then we are given the pros and cons of each side. So we are able to understand better kapag may mga ganon. So sa dysfunctional conflict, there is dysfunctional conflict disrupts it hinders job performance and upsets personal psychological functioning. Then we also have the functional conflict, yung kabaliktaran naman ng dysfunctional conflict. There is functional conflict if conflict is responsive and innovative, aiding in creativity and variability. Katulad nga ng pagkakaroon ng debate. It's a functional conflict. Oo, meron kayong argument, merong mga pagtatalo, but the end result would be good kasi nga napag-usapan ninyo yung punto ng bawat side. Naibigay nyo yung mga advantages, disadvantages ng bawat side. So you can be able to decide better. Hindi tulad sa dysfunctional conflict, basta nagkagulo lang kayo. Kaya nga, it hinders job performance, hindi kayo magkasundo. So, yun na yun. Dysfunctional conflict ang tawag doon. Okay, crime and conflict. Criminal behavior as an indicator of conflict within the person, emphasizing either failure to resolve tensions generated in the course of interaction between the organism and human figures in its environment, and then tensions generated by a person's inability to satisfy the contradictory expectations of others. Dahil may ine-expect ang iba, 'pag hindi mo ma-meet yun, nagkakaroon ng tension, nagkakaroon ng conflict. Or else to mobilize the resources needed to perform a role assigned to him. Okay, next is depression. So take note, it is an illness that causes a person to feel sad and hopeless much of the time. So hindi ito yung nalungkot ka lang, nawalan ka ng internet, di ka nakapasok na depressed ka. Hindi siya ganun. Kasi pag sinabing depression, sakit talaga ito at continuous yung kalungkutan. I think ang standard is 2 weeks na dire-diretso na never kang nakaramdam ng kasiyahan or kaligayahan within that span of time. Then that's depression. So it is different from normal feelings of sadness, grief, or low energy. Iba yon, yung malungkot ka lang, iba yan sa depression. But anyone can have depression. It often runs in families. So may uh, sabihin na nating chance na ma-inherit mo ito sa sa iyong pamilya, yung pagiging depressed. Ano to, nagtitake sila ng medication ha. But it can also happen to someone who doesn't have a family history of depression. Kaya nga sabi ko, kahit sino, pwedeng magkaroon ng depression. Pwedeng mamana or pwedeng na-acquire mo na lang talaga. You can have depression one time or many times. Pwede kasing gumaling ka na sa pagkakataon na to, then you may fall into depression again. Depende nga depende rin yan sa emotional intelligence ng isang tao. So what causes depression? Major events that create stress such as childbirth or a death in the family. Uh, ano kasi tawag doon? Postpartum. Kapag nanganak ka and then parang kakaiba yung feeling. Ganun. Childbirth. Postpartum depression, ang term nila. And then we also have illness such as arthritis, heart disease, or cancer. When you suddenly know na may sakit ka pala na malala, yung ganyan, na pwedeng taningan buhay mo, or uh, it could really deteriorate your health. hindi ka na makakapag-function ng maayos. So it could cause depression. And then, certain medicines such as steroids or narcotics for pain relief could also cause depression. Then, drinking alcohol or using illegal drugs, pwedeng maging side effect niyan. Symptoms of depression. Paano niyo malalaman na may depression ang isang tao? They think and speak more slowly than normal. Kumbaga, may normal na pace ng pagsasalita. Itong pagsasalita ko, ito na yung normal ko. Kapag mabagal ang pananalita ng isang tao, na hindi normal para sa kanya. Kasi baka normal niya yon na mabagal siyang magsalita. Basta yung hindi normal na mabagal magsalita, it may be a symptom of depression. Then you have trouble concentrating, remembering, and making decisions. Yun yung mga nagsasuffer from depression. Kasi nga, ang naiisip lang nila, yung feelings nila, yung recurring feelings of sadness. Hindi na sila makapag-isip ng iba pang bagay. Then they have changes in their eating and sleeping habits. Di na makakain, di na makatulog. Parang in love lang eh, no? Pero ganun. ah Walang gana kumain at parang nagiging insomniac siya. Then they lose interest in things they enjoyed before they were depressed. Yung mga hobbies niya, yung mga ah, sports na ginagawa niya, hindi na niya ginagawa. They have feelings of guilt and hopelessness, wondering if life is worth living. They think a lot about death or suicide. Then they complain about problems that don't have a physical cause, such as headache and stomach ache. Kumbaga, masakit ang ulo nila, sinasabi nila masakit ulo nila o masakit tiyan nila, pero wala namang physical cause. Hindi naman dahil puyat siya. Kasi minsan, di ba, pag puyat tayo, masakit ulo natin. Hindi ibig sabihin nun, depressed tayo. Talagang kulang ka lang sa tulog. Pero itong mga tao na nakakaranas ng depression, walang physical cause. Pero, yan nga, may nararamdaman sila. Okay, there are also different forms of depression. We have major depressive disorder, dysthemic disorder, psychotic depression, postpartum depression, nabanggit natin yan kanina kapag bagong panganak ang isang nanay, seasonal affective disorder, bipolar disorder. Pag sinabi kasing bipolar, bi means two. Pag polar kasi, dulo. Kumbaga, pag sinabing bipolar, dulo-dulo ang emosyon niya. Sobrang saya, tas biglang sobrang lungkot. Mga ganon. Endogenous depression, situational depression or reactive depression, and agitated depression. So how do you battle depression? First is socializing, eating out, movies, ball games with family or friends. Although, medyo mahirap yan kung meron kang depression. But that's one way on how you deal with it. Then helping others in need, volunteer work, feeding the homeless and others, that can help you move past depression. Then praying works for all moods, especially depression. Okay, depression and criminality. People with depression might be more likely to commit a violent crime than those without depression, a new study suggests. Researchers analyzed data from more than 47,000 people in Sweden who were diagnosed with depression and followed for an average of 3 years. Ang dami, no? They were compared to more than 898,000 gender and age-matched people without depression. So people with depression were 5 to 6 times more likely than those in the general population to harm others or themselves. Mas malaki yung tsansa na manakit yung mga taong may depression kumpara dun sa mga taong wala. So this is according to the researchers at Oxford University in England. One important finding was that the vast majority of depressed persons were not convicted of violent crimes and that the rates reported are below are below those for schizophrenia and bipolar disorder, and considerably lower than for alcohol or drug abuse. Specifically, almost 4% of depressed men and 0.5% of depressed women committed a violent crime after their depression diagnosis, compared with slightly more than 1% of men and 0.2% of women in the general population. Quite understandably, there is considerable concern about self-harm and suicide in depression. Kasi nga, kapag may depression ka, dahil more likely, mananakit ka dahil nga hindi mo makontrol yung nararamdaman mo. You cannot self-regulate when you are battling with depression.